Well, a warm welcome to this talk. Now, last week we looked at information from the COVID inquiry of Scotland, which seems to be a remarkably useful inquiry, unlike other ones that could be mentioned, in that it's looking at the experience of individual ordinary people. And the big thing that's concerning me from this inquiry is unnecessary deaths. Last week we looked at the use of midazolam, often in combination with morphine, and the consequences that come from giving midazolam with morphine, of course, are well known. This week we want to look at do not resuscitate orders. Now, these are sometimes called DNRs, do not resuscitate orders, sometimes called DNAR, do not attempt resuscitation, sometimes called DNAR CPR, do not attempt cardiopulmonary resuscitation. All means the same thing, and these have been put together for us by Dave, independent researcher, who's done a lot of the donkey work, listening to the many hours of coverage on this. Now, this one's from Miss Gillian Grant, who had full power of attorney for her gran. Now, that means that she had the power that gran would have had she been young and fit and able to make her own decisions. That power was delegated legally, completely, to Gillian Grant, the granddaughter. Full power of attorney. Now, there was a do not resuscitation order signed, or not signed, as the case may be, as we'll see, 2nd of November 2020, and Gran died on the 4th of November 2020, 2 days later. It turns out that this DNR was not known about at all by Miss Gillian Grant. She hadn't signed it. In fact, the possibility of a DNR had been brought up and completely rejected. And it appears it had also been signed by the GP. This is completely unacceptable. And there's another problem here with DNRs. Now, do not resuscitate applies to a particular situation where someone basically goes into cardiac arrest or respiratory arrest. It's a situation I've dealt with many times. The patient's heart will typically fibrillate. There's no effective cardiac output. And shortly after that, the patient will become unconscious. And shortly after that, they will stop breathing. There may be agonal respirations for a period of time. And that needs resuscitated. We can give cardiopulmonary resuscitation to maintain the circulation. But you're only going to get those patients back by using defibrillation to give them the shock to take the ventricular fibrillation back to sinus rhythm. That's technically what this means, but many nurses interpret DNRs, do not attempt resuscitation orders, as, well, basically we've gone on to palliative care. We've basically given up on saving this patient's life. This is completely wrong, but this is the way it's often interpreted. And my experience of this, again, is extensive, having over 40 years experience working as a nurse and with nurses. So it's often a sign that it's time to sort of give up, but it shouldn't be. It's quite specific to resuscitation. This doesn't mean we don't give these patients antibiotics. We should do. This doesn't mean to say we don't give patients subcutaneous and intravenous fluids. We should do. All these things should still carry on. It's just in the event of a cardiac arrest or a respiratory arrest, there'd be no what we call heroic interventions. And the principle here is we should not fight for life in a way which is officious. You should not hang on to life in an officious manner. That's the principle, and it's one that I agree with, but it's often misinterpreted. Anyway, listen to Miss Gillian Grant's testimony now, and the sad death of her mother, her grandmother, 2 days later.
And you subsequently ascertained that there was a do not resuscitate notice in relation to your gran.
That's correct.
Can you just explain how you came by that information?
We had heard that there was a possibility that there was a do not resuscitate order. After my grandmother had died, we'd heard from the solicitors that there was talk that there was a do not resuscitate order in my gran's file, but nobody had ever seen it, so we didn't know the full facts of it. But when I actually sat with the inquiry team to give this statement, my solicitor produced the do not resuscitate order, and it had my name on it. and it was dated on the 2nd of November. And it, sorry? I've got a copy of it, but it's kind of block capital letters with my name.
So in other words, not your normal signature?
Not my signature at all.
Was the possibility of a DNR notice ever discussed with you by the care home?
Yes, it was.
Yeah. And could the care home have understood from the discussion that they had with you that you might be authorising a DNR notice for your grandmother?
Absolutely not. My exact words to them were categorically, I do not want to put a do not resuscitate order in place.
You tell us in paragraph 65, which is a lengthy paragraph about this, that the DNR is incomplete.
Yes.
How is it incomplete beyond the point that you've just clarified with His Lordship about your signature?
There's a section in it that asks if the patient is aware of the do not resuscitate order being in place, and there's a box to tick yes or no, and neither box is ticked.
Well, quite upsetting, I'm sure you'll agree, on a number of levels. Now, I've put the link to this full witness statement here. You can read it for yourself. It is quite extensive and fully documented. I'm just going to highlight a few parts. The part of the do not attempt resuscitation order that is signed by the GP and is dated for the 2nd of November. So it appears that the GP had signed this without consultation with the person who had power of attorney. Completely unacceptable. Had it been discussed fully with the patient? Perhaps, we don't know. Maybe not. We simply don't know that. But even so, we should never take one of these out without full consultation with the relatives, especially if someone has full legal power of attorney. This is completely unacceptable. On this date, my gran was showing only very mild signs of COVID symptoms. So very mild COVID. And we now know that most people that had very mild COVID, even if they're old, even if they're in a very high risk category, would make a full recovery. Just with supportive treatment. Even if we only gave them food and fluids. As long as we didn't give them any drugs, let alone drugs that could have helped them. Or, if we just did nothing, apart from normal activities of daily living, most of these patients would have survived. My gran suffered from mild dementia, but had enough capacity to make her own decisions. I asked about a do not resuscitate order, but categorically stated I was not prepared to make any decision on a do not resuscitate order if she was not critically ill. And I knew she could make these decisions for herself. I was very clear and strongly worded on this with the care home. So correctly here, Gillian Grant says, look, there may be a time when we need a do not resuscitate order. If my gran is critically ill, if she's suffering severely, if there's no chance of recovery, then yes, I'll consider that in this circumstance. But doing this one as an advance was categorically rejected, and yet apparently her name was written on it in block capital letters and signed by a medical doctor. From what we know here, from this witness statement in the public domain presented to the COVID inquiry, this practice, in my view, with over 40 years experience, is completely unacceptable. This should happen. Now, this is one case. I am going to show several others that Dave has put together for us. But how common is this? Now, from your comments last week on the video about midazolam, it appears absolutely clear that this midazolam morphine intervention was not restricted to Scotland. It was actually in many, many areas of the world. And of course, as well as the outrage of letting someone die or facilitating someone's death prior to the time that would have occurred, as well as this, we believe that Gillian Grant's gran's death was put down to COVID, whereas it might not have been at all. It could have been the lack of intervention, or was she given midazolam as well? We can't remember. Maybe. We don't know that from this part we're looking at today. And of course, this makes COVID look like a much more deadly disease than it actually was. If all these deaths were put down as COVID, and they weren't, and how many were tested positive for COVID, again, we're not told that. It gives the whole thing starts to look like a very distorted picture. Anyway, I'm going to put some more of these up. I think I'll leave that up for now because I've done a bit of an introduction and gone on for longer than I expected to. So we'll put this up as a separate video and then we'll look at some more of these. Do try and watch them because it's practice that, in my view, should never, ever have happened, and certainly not happened in the way it did. And it's great that the Scottish inquiry is highlighting this, whereas the English one, so far, from what I've seen, isn't.